I am. Thank you, Michael. Good morning, everybody. And thank you, Ayodola, for your remarks as well. On behalf of Mary and Bill and our Action Collaborative, I want to welcome everybody to this morning or this afternoon's program. Looking forward to a very interesting couple of panels who I think will give us some examples of best practices in really engaging community in effective data sharing to solve really community issues that are prioritized by a community. Our meeting today will, of course, talk about sort of diverse data sets that are generated, embedded at local levels, what meaningful engagement by community actually looks like, and in particular, explore some of the components of what creates good governance for these initiatives. I think that as we think about the principles of our collaborative in particular, the notion of trust and of shared power is something that I think will run through all the presentations you will hear today. And I think we recognize is critical to the success of effective data sharing at a community level. And of course, what are we aiming at here? Really trying to demonstrate the value, both social and economic, as well as in health outcomes more broadly. And I think the panel will touch on a number of these issues. I'll just name that in California alone, our legislature recently passed a bill requiring a data sharing framework to be developed for the entire state of California. These are health systems, hospitals, clinics, but not just the delivery system, also not-for-profits, community-based organizations. And we are in a very vigorous conversation today about what that governance structure ought to look like. Michael mentioned the report that NAM did on data sharing, and there are a number of obstacles that are named there, and among them is lack of trust in our data systems that exist in our healthcare system and our delivery system in particular. And I think that's something that we are going to need to overcome. And a lot of the ways of doing that is to pay attention to the governance structures and the policies and procedures by which data is effectively shared. We're in California where, as you might imagine, we have consumer advocates at the table. And we also have our health systems who tend to look at things somewhat proprietary. And I think increasingly what you see is a vision for a more consumer-centric data sharing policy and procedure and governance structure. The reason for that, of course, is that we have a very fragmented healthcare system today. It does not adequately collect information on social determinants, which we know contribute very deeply to health inequities today. And we recognize that our behavioral health social service systems are fragmented in a way that really create incredible inefficiencies and unnecessary costs and expenditures. And so the opportunity that we have for engaging community in an equal sharing way in terms of power and governance is really critical to anything that we're trying to do to achieve health equity in our systems. I'll name also that among our speakers, we'll be hearing from folks who are leading regional health information systems, and the importance of really looking at a local level and regional level for data sharing in an effective way. Another important principle, I think, that we'll extract from our speakers that we are hearing about today. So with that, it's my incredible pleasure to turn the program over to Reed Tuckson. He's going to introduce our panel and moderate this morning's session. And I'm very much looking forward to learning from our digital health colleagues. And with that, I'll hand it over to you, Reed.